Welcome back to those who've been with us already today. Hope you've enjoyed the session so far, and welcome along to anyone joining for the first time. Just a reminder, the sessions are being recorded and you'll be sent links in the coming days if you can't be with us for all of them. Please send your questions in and we'll answer as many as we can at the end of the session. So our third session of the day is with Matt O'Sullivan. He's going to be talking to us about the Posturite Managed Service. This is a way of saving time and keeping DSE users safe and healthy in the move to hybrid working. Matt's a regional manager here at Posturite. He's been with us for 15 years and works with some of our largest clients, as well as heading up our managed service. So I'll now hand you over to Matt and I'll join you back for the Q&A shortly. Hi, Matt.
Thanks, Matt. Good afternoon, everybody, and thanks for joining our this part of the virtual conference today. As Matt said, I'm Matt O'Sullivan. I'm a regional manager here at Posturite, and now also more involved in our managed services. So this session, I'm just going to look to outline some of the things that we've been doing at Posturite to support our clients and their DSE processes. And as we've heard, particularly in light of the move to home and now more hybrid working, and how by outsourcing some or all of your workstation assessment processes can create more efficiency for your organization and ultimately hopefully save you time in your roles. So the plan for this session today is just to spend some time providing you with a bit of an introduction to our managed services and the core tasks that we can help you with. We've then put together a bit of a short video just to outline a typical end user's journey through a typical DSE process with us. That's going to include a short introduction to the agile working module from Workrite, a sample triage call, and then we've got some feedback and thoughts from a couple of our existing managed service clients just to share with you. I'll then be on hand to summarize and answer any questions that may have come through. So I think, as we've already heard on the sessions today, the last 12 months or so has seen an obvious acceleration towards both home and now what appears to be a longer term hybrid working model. So what this has done, it's created a huge increase in requests for support from our clients for home worker assessments, for support in rolling out a workstation assessment process to employees working at home, and just some general advice really on how to approach the shift. With our years of experience, I think, in ergonomics and providing assessment services, we are aware that DSE assessments, and particularly new and major rollouts, can be both time consuming and they can require a range of specialist skills to deliver effectively. And that can essentially take a lot of time away from some of the higher risk or more pressing tasks that you might have to do in your day-to-day roles. So how can Posturite help? So I've just got a few slides to share with you at this point. So although we have been providing workstation assessments and managed service support to our clients for a number of years now, we're offering now a more holistic service to clients that goes a little bit above and beyond the sort of specialist, maybe ad hoc requests that you might traditionally request from us. In January this year, we actually formally launched our managed service division internally, and that was because we felt like we had the right number of managed service clients, the number of requests coming into the business for this type of support was growing. We had a team of employed case managers that was also growing, and it just felt like it was the right time to sort of launch this division within the Posturite umbrella. And we felt that we could essentially offer value and support to clients in two main ways, really. Firstly, sort of directly to our main stakeholders within businesses, so whether that's the health and safety managers or facilities managers that we work closely with, we understood that sort of managing DSE was a task that was essential for your organizations, but essentially it's very time consuming and probably not always top of the priority list. And then secondly, to every employee within your organizations that might need support following a DSE assessment, particularly if they were suffering from musculoskeletal issues. So yeah, that really drove back to sort of some of the core services that we do provide as a business and that we're probably most well known for. So what our managed service is essentially, it provides solutions to clients. It gives them the ability to outsource the management of their DSE or workstation assessment processes to our team of fully employed case managers. With our expertise in providing formal assessments, both via our network of assessors and our background in historically developing and managing the Workrite tool, we do have first-hand experience in providing a service where there now appears to be a growing need. With this experience in mind, as well as the hundreds of hours of experience that we've now got in managing Workright and supporting clients with their other DSE processes, what we look to do is essentially build a bespoke workflow for you to ensure that managing DSE becomes as efficient as possible for your organizations. We understand that the implementation of any managed service is absolutely key. So we're aware that everybody will have a slightly different approach to this. What we look to do is to become an extension of your team or process, and we'll follow any specific instructions that you may have as we discuss and manage issues for your employees. That could be as simple as ensuring that somebody has had a detailed review of their existing workstation, advising how to request an eye test, right through to escalating requests for equipment, new equipment, or for equipment from the office, or even needing a more specialist assessment for whatever reason that might be. So our case management provides an end-to-end service that can include rolling out workstation assessments, managing starters and leavers, managing any ongoing cases as part of the case management process, specific consultancy support if that's needed to advise on policy or procedures, and then providing regular reporting and management information. Alongside the sort of core administration and management tasks, I think it's our triage service that really sets aside the service and provides the sort of the value and support that our clients are looking for. So run you through what the triage service entails. It's essentially a bridge between our staff, between your staff completing their DSE assessments and then any formal or specific actions that might be required as part of the process. So it's probably the task that our team spend most time on within our contracts, where we're reviewing and providing triage calls to your employees, just so that we can confirm and discuss their issues and then very quickly provide support. Generally, in most cases, we find that sort of short triage type discussion, covering the points raised in the assessments, can generally help resolve most issues. And I think it's the sort of the expert advice of our case managers that really helps achieve that. What we can do within a triage call, though, is where needed, we can refer staff who might need more specialist support, whether that's a higher level ergonomic assessment or even a disability based assessment, or those who might need alternative equipment at home or in the office. We've got the ability to escalate that back into your business or into our more specialist teams to manage. So by letting our team manage issues in bulk, we can prioritize and contact groups of staff and resolve outstanding issues quickly for you. We generally look to focus on high risk issues first, and then we will move on to sort of all of the lower level issues down the line. As already been mentioned today, as we do move towards a more hybrid working model as we come out of lockdown, we also look to sort of try and provide continuity around how we manage your cases. So you will have staff who will probably be working in multiple locations in the future, and hopefully our case management solution will allow us to provide a bit of continuity and confidence in our approach, so that those users are getting essentially the same case manager managing their issues in those multiple locations. I think it's the triage part of the service is probably the most crucial part for the majority of our existing contracts. So I think one of the main messages here, following sort of the core services that managed service can provide, is that our offering can be very, very flexible. So it might be that you don't need the full outsource model and there's some specific administration on your existing systems that you need support with, or that you've got a big or a pending rollout coming up that you are aware is going to probably create an influx of cases for you, and you might just need some short-term support in managing and contacting those staff and discussing any issues that they might raise. Equally, some clients have recently just purchased triage calls, for example. So what we can do there is you can refer those members of staff who need specific support from a case manager, and we can manage that case and provide you with the notes associated to any conversations or discussions that we have. So there are parts of the service that we can provide if the full outsource model isn't something that you're looking for. So yeah, essentially the message here is that it's not one size fits all, and we will work with you to plug any gaps that you might have. I think it's really interesting that right now seems to be the crucial time time as we all move towards what will be a more hybrid working situation in the future. And we're hearing and discussing with lots of clients how they're planning on approaching and managing DSE as part of this. So hopefully some of our expertise can help in the future. So at this point, as I said, we've prepared a short video. I hope this provides you with a bit of an overview of what a typical managed service journey can look like for you and your staff. It includes a quick look at the Agile Working course from Workrite, and then how the self-assessment links into a triage call. We've then provided a quick example of what a triage call could look like. You can see how we generally approach those, and it gives you a quick example of how some simple chair adjustments can help users when they're working from home. At the end of the video, we've also just got a couple of existing clients running through some of the key benefits of using a managed service, and yeah, we thank them for spending the time and sharing their thoughts with us. So yeah, thanks, Adele.
With the rise of the internet and portable technology, office life has become more flexible than ever, and you are increasingly able to choose where and when you do your work. Whether you predominantly work away from the office or you simply answer the occasional email on the train, it's likely that this agile way of working has affected you in some way. It's important that you know how to benefit from agile working and that you limit practices that could be detrimental to your health and productivity. Poor short-term decisions can increase your risk of discomfort, stress, and inefficiency. Understanding your choices and making suitable decisions can help you to remain healthy and productive. During this course, you'll explore some of the different environments you might work in, the equipment you may use, and see how these can benefit your working life. Depending on your working environment, you may need to pass a test and complete a DSE assessment at the end of the course. One of the great things about working at home is that I avoid the stress and cost of travelling during peak periods. It's easier to work at home when I want to concentrate without any of the typical office distractions, and it's great for making confidential or sensitive calls in private. There are some disadvantages in working at home too. It can be difficult to concentrate with my family around me while I'm trying to work, so sometimes I use headphones or go into another room. It's tempting to constantly check work-related communications or be available even during breaks. So I switch equipment to silent and put it to one side. When I finish work, I turn it off completely. Working from home for long periods started to make me feel a bit isolated from work and colleagues. So I had a chat with my manager and built activities into my day to make sure I don't lose motivation or feel stressed when being isolated.
Once a user completes their Workrite training, they're then required to undertake a short test just to ensure that they've understood the training. That then enables them to move on to the self-assessment, and you can see a quick example here of the chair section of the self-assessment. This should just provide you with an overview of what this looks like on the system.
Just to give you some background on myself, Claire, I've been working alongside your company now for about 4 years or so, and my primary role is just to sort of follow up with any issues that you have raised when you complete your self-assessment online. And what I'm doing at the moment is just getting a bit of an understanding from people, I guess, as to where people are working at the moment. Are you doing a split between being in the office at home, or are you still full-time at home at the moment? So get a bit of an understanding as to where you are working and what your current setup is at home as well, if you are, or wherever you are working. And then from there, it will give me sort of a good idea as to what we need to do sort of moving forward. We can obviously pick up and discuss any musculoskeletal issues that you've reported as well, because as part of my role, I am following up with the issues that you raised online. As I mentioned, Claire, we sort of do follow up with any issues that have been raised on your self-assessment online. And one of the issues that you did raise was regarding sort of, I think it's back-related pain. It's quite generic, so it doesn't go into too much detail. But if you wouldn't mind, Claire, could you just give me some background to any pains, discomfort you are experiencing at the moment, or any sort of workstation-related issues?
Yeah, of course. It's largely my lower back area, and I just kind of find that really I just get a little bit stiff and it gets a little bit tight and uncomfortable when I've been sitting in the chair for you know, a long period of time, really. And my work basically is an admin role, so I'm basically at my desk, you know, for those hours that I'm working, basically. So.
Obviously, you mentioned that you can get a little bit of tension in your shoulders. There's always a few sort of go-to areas that we would look at for those sort of pains, discomforts. Typically, it can be aggravated by just desk height, no, sitting height in your chair. Obviously, if you sit slightly too low in relation to the desk, then whenever you're sitting and whenever you're trying to utilise the keyboard and the mouse, essentially it can force your shoulders upwards when you're working. So I guess the idea of the exercise today would just be to get your shoulders in their sort of naturally relaxed positions and support them in those positions, and just make sure you are set up to the right height in relation to the desk.
Okay.
So what I've done, Claire, just as I've been speaking to you, I have sent over a PDF document, and it's a bit of a side-on view of somebody at their workstation. So it will just give you a bit of advice of, as we're talking, something to refer against, just so you can see somebody at their workstation and sort of what we're referring to against.
Right.
So the first thing I'd like to check, Claire, if it's okay, is your sitting height in the chair.
Okay.
So there's three things that we look for in your sitting height. One of them is to have your feet flat on the floor or the footrest. I know you don't have a footrest.
Nope, flat on the floor.
Okay.
Yep.
The next one is to make sure your hip is slightly above your knee when you are sitting.
It's probably not quite as high as it could be.
Okay. Would you say your knees are pretty much flat with your hips at the moment?
Yeah, I would, yes.
Okay, fine. So the consequence of that, I mean, we always look to advise people to have your hips slightly above your knee when you are sitting. If your knee is sort of level or ever elevated above your hips when you are sitting, it can cause a sort of under rotation of the pelvis.
Okay.
So what will happen is when you get that under rotation of the pelvis, it will straighten out the natural curvature that you have in the lumbar region. So it's really important, obviously, if you are sitting for really long periods throughout the day as well, just to make sure that you have that sort of natural S-shaped curvature in your spine when you are sitting. So if it's okay with you, Claire, would you mind just sort of bringing your chair height up just a fraction, just so we can achieve that hip over knee?
Okay. Yeah.
Okay. Just to double check, your feet are still flat on the floor?
Yes. Yep.
Okay, perfect. So the third thing that we look for in sitting height then is to, obviously, when you're sitting in a good upright posture, you've got your feet flat on the floor, you've got your hips slightly above your knee. We then want to make sure that when your elbows are in their relaxed position, that they are pretty much the same height as the desk.
We can now see the management tool in WorkRite, where our case managers can view open issues as well as provide the crucial audit trail of actions taken to support staff who need support. We can see what issues still require support, and then following a triage or formal assessment, we can update notes in line with the client's bespoke workflows. Notes are available as a permanent record of actions we have taken, and as you can see in this particular case, this will be closed once a chair is delivered and a further follow-up is undertaken. Once the note is added, the status is moved to in progress and updated, and this will be revisited in a couple of weeks' time for this particular individual.
We're obviously predominantly office-based, being an insurance company, and obviously the biggest part of that is DSE for me, being the health and safety person. So having something like the managed service and Nick on hand is brilliant. It could be just general sort of triage calls, just sort of making sure people have got their desk set up correctly. It could be that it's more in depth around a specific condition, something like that. So having that for me is brilliant, because it actually takes a lot of the stress away and it just saves me lots of time.
Me trying to triage 3,500 responses was a daunting prospect. We spoke to Nick and Christina. We agreed that the approach we would have. So our guys complete the online assessment, and then Christina does a fantastic job of following up on those, checking with issues, speaking to people, emailing, and then escalating us the cases where there's a greater level of intervention involved. We had regular interactions through the first month or so, and as the system embedded, they've sort of stepped back. We've agreed our weekly reporting. That arrives on time, all set up as we want it. They're there if we need them. If I've got an issue, quick email to Nick or Christina saying, this is the problem, can you have a look at it? And generally within a very short period of time, I've got a response, or at least I've escalated this and this is where we're going to end up, hopefully. So it saves me a heck of a lot of time.
Okay, so I hope that provided you, or that overview provided you with a bit of a flavour as to how a typical process could work for you and your employees. I think the first point to note there is that the first part of the presentation showed a sort of a typical DSE training solution that's available. Although we work quite closely with WorkRite, our managed service isn't tied into this. So if you are using an alternative process and you're still looking for some support, we can still help. We have actually implemented and supported processes for clients who don't have an e-learning system embedded at all, as well as those who have other incumbent or existing legacy systems in place. Equally, however, I think if you are looking at implementing a system or reviewing what you're currently doing for your DSE assessments, we can link you into the WorkRite product via Ideagen. So yeah, we can introduce you to the team there if that's something that is of interest. I hope the sessions around the triage call were useful, and they showed how we look to engage and provide hopefully some quite simple and effective solutions to staff who need help quite quickly. And I just want to sort of, I suppose, advise that we're able to provide these sessions all across the UK. Equally, we are able to support clients globally in some key markets. Essentially, that service is remote, as most of the triage calls are in the UK, but we do also have access to a network of consultants who can either support assessments in local languages or more formally on site if that's ever needed. And then in terms of ongoing management of the managed services, we'll provide you with a regular overview of the time we're spending on your contract. Again, we've got a number of different models that we can engage with you in terms of pricing, and again, happy to discuss any of that in more detail if needed. All of our MI is very specifically tailored to each of our clients' requirements, and would typically report back on that monthly, just so that you've got a full overview of what we're doing, where we're helping, and then picking up any other challenges that you might have. So yeah, I think just as a bit of a takeaway, if there are any other additional questions, or you'd like to spend some time sort of discussing any processes, plans that you're thinking about, if there's any suggestions that we can make to sort of help ensure that you're making best use of your time, please feel free to reach out. More than happy to help. Again, we can give you some sort of some example proposals or ideas on how much time or what costs are involved with the solutions that we can provide. So yeah, it'll be great to discuss any questions you have. So please don't hesitate to get in touch. And thank you. Yeah, and I'll take any questions, Matt, if any have come through.
Thanks, Matt. Yeah, that was great overview, I think, of what the system looks like. So yeah, we've had quite a few questions, Matt, so get prepared for these. I think we had a few issues joining this session, so if you did join late, don't worry, you'll be sent the link to the recording in the next few days. So the first question we had through, Matt, was about the qualification of the assessors. What level of qualifications do the assessors have?
Yeah, okay, so all of our case managers, as we are referring to them now, they're all fully qualified DSE assessors. It's actually a role within Posturite that typically is a promotion from our normal assessors. So they generally have a lot of experience in providing assessment services or our traditional assessment services to our clients. Alongside that, they're then obviously very well they've got a lot of experience then in managing client systems and understanding those processes, and they get very embedded in that organization. So yeah, again, they'll have full DSE assessor training under their belts, as well as the normal sort of physiology backgrounds that our assessors typically have.
Okay, great. Thanks, Matt. You mentioned a few times in your presentation about it being flexible and bespoke. So the question here was around how does setting it up work? What does that process look like? So is that the key message, that it's flexible and bespoke, and give you a case manager. They would help run through the implementation of this and embed it in. Do you want to elaborate on that a little bit about how setting it up works?
Yeah, of course. So yeah, what we'd look to do is we've got an implementation manager and then the case management team. So what we'd look to do at the outset of any contract is we'll have some fairly detailed discussions around how to set up the managed service for you. We would build you a bespoke workflow. That's essentially a bit of a decision tree. So we need to understand kind of what your process is, what your usual actions and responses are for those, and then we'll just try and slot into that based on those initial discussions. We'll then build you a workflow, we'll share that, we'll have regular updates, and then you're essentially assigned a case manager. So although we can put a team on contracts if they're very large rollouts, you'll have a lead case manager there alongside the implementation manager who will sort of link into you, and especially at the outset of contracts, be in regular contact to make sure that we're setting things up and running things as they need to be, as I say, so that it almost become an escalation or part of the team or process that you've already got in place.
Great, yeah, thanks Matt. I think you covered this a little bit, but we'll ask it. How does it work when assessing people in different locations? So I think possibly not just in the UK, but globally. I know you and I both have clients where they've got offices in Asia or the Americas. How does it work with that, with time zones and different DSE legislation, I guess? How does that work?
Yeah, good question. So there's a couple of things there. I think what we look to do is generally try and work within our clients' own policies and procedures and use what they've got in place as best practice, and we'll fit into that. So we're probably not really in a position to be able to at this stage give you very specific guidance on what the legal requirements are in Singapore or in Germany or whatever the countries might be. But if you're looking to roll out a policy that provides best practice to all of your staff wherever they might be, then we'll look to manage that way. Essentially, because a lot of the systems that you might use to roll out training and assessment are online, it's very simple to roll that out globally, and then our team can pick up all of those issues remotely. And generally our triage and all of our remote assessments can be done online over Teams. If there are time zone issues, we can look to manage that as best we can from the team here. But as I said, we do have a network of consultants. So if you've got a very specific time that needs to be catered for, or an assessment needs to be done in a specific language, we can go and engage with our network of consultants and support that individual wherever they might be in the world.
Okay. Thanks, Matt. And I think what we've found is that a lot of clients use the UK as the sort of gold standard when it comes to DSE and assessing people. So they'll often use that in those other locations to work on a best practice method. So thanks for that. Quite brief, but how much was the next question. How does pricing work?
Yeah, so essentially what you're doing is you're buying time. You're buying time from us essentially. So yes, our day rate is £450. What we look to do at implementation is really get a flavour or an understanding of kind of how many people you're looking to roll this out for, sort of what sort of issues you want us to cover off, and we'll give you a sort of a guide or an estimate as to how much time we think it might take, how many days you might need, for example, to sort of manage the potential number of cases that comes through. But again, that's flexible. Typically clients will buy a chunk of time, and then we'll let you know how quickly that's being used up or not, as the case may be, depending on how busy things are, and then you can decide whether that's something that you look to top up as we go through the process with your organization.
Okay, thanks, Matt. Just to prove that this is live, we've had an update to the question that was asked a moment ago. They asked about assessing the individual at home and then in a different place, like the office. So not just global, but also within the UK if they're working in multiple locations. How does that work?
Yeah, so again, as we're calling it case management, what we would look to do is have a single case manager managing each case. So they'll be responsible for any issues that individual highlights, and what we'll look to do is probably do an assessment at their main location, and then I think cover off any other actions or issues that there might be in their secondary workstation. So, as we said earlier, there's normally a sort of a predominant working environment, whether that's 3 days at home, 2 days in the office, or whatever that split might be. So we'll look to cover off as many issues as we can in the predominant location or where there are the biggest risk issues. But again, because we've got a case manager assigned to that individual, it would be that case manager who would manage that case all the way through and update the relevant notes accordingly. So they should provide that very kind of holistic and approach to that case and dealing with the issues that might come up.
Great, thanks, Matt. I think we're going to have a bit of a longer break before the next session starts at 4:15. So thank you very much for joining us for this session. Hope you found that useful. And yeah, if you do have any questions, feel free to pop them through to events@posturite.co.uk and we'll get back to you on those as soon as we can. Thanks very much. Thanks, Matt.